Dr. V. Pattabhiraman. I'm presently professor of orthopedics in a private medical college on the outskirts of Hyderabad. As Manisha said, I was in the army for a little over 31 years. I retired about 15 years back, and since then I'm in a medical college. See, nowadays I'm on this teleconsult for the last couple of years. So a lot of patients that I see are all young people. This um, what Gen X or whatever or millennials, which are all in the ranges of about 25 to 35 or 40. So, and I see the lot of you are in the where are you working? IT or software. So what do you do? Nothing. I sit in front of a laptop. So how many hours do you sit in front of a laptop? So that's my question. And most of them say, I said 8 to 10. They say at least, even maybe more, 10 to 12. So, and then the next thing is, do you feel the occasional aches and pains in the back, the lower back, the mid back, the upper back, the neck? And most of them come with those complaints. And then the questions go on, what is your nature of your work? In fact, it is not that they are, laborers lifting lots of weights who are expected to have backaches. Laborers, which are, I think, when I'm just getting my house refurbished. So when I see those guys lifting those weights, I say, God, yeah, they must be getting backache. But yes, they also, now that they know I'm a doctor, they have told me occasionally that they get some backache. But you see, a lot of them, they are used to it. Probably they have the correct technique of even lifting weights. Everything has got a correct technique to do so that you can do it without causing injury to your body. So as we've seen now, I mean, the typical government job used to be 9 to 5. Go in at exactly 9 o'clock and set your table and all that. And if you're a clerk or a manager or whatever you were, you just sit there and push some files from here to there and wait till 1 o'clock. And 1 o'clock, you put your pen down, go into the canteen or wherever you sit with your friends, have lunch. 1 to 2, come back 2 o'clock, 2 to 5. 5 o'clock, you put your pen down, close the office, and go home. But today, I've seen my own children, my daughters, they have no fixed working hours. So one would think, and this, thanks to this COVID pandemic of 2020, so we are having a lot of these working from home, both men and women. One would imagine working from home would be lovely. Wow, so nice, just sitting at home and relaxing. But no, the working from home means you have to produce results. So it's not as if there's a CCTV, but then the person, your boss, knows how much you're working because the output has to be there to show that you're working. So now I've realized that working from home sometimes is worse than going to office because office at least has a particular time. If not 9, you go at 10 o'clock. If not 5, you come back at 6 or 6:30. But now, since it's working from home, your bosses expect you to produce results, and they're not bothered about the working hours. Well, they say you're at home already. What's the problem? I want this done by so and so date. Most of them say I want it done yesterday, or in the next 1 hour, or the next 2 hours, or the next day, which is going to take so much. So, working hours are actually hectic. I mean, I see my daughter coming back home, say at 8 o'clock. Oh, I say, oh, we've been so tired, and she's on the phone already, or and she'll say, okay, bye bye, and she'll go up and start off. Same thing with my the other daughter in the US. She says, I'm working 16 hours. 16 hours a day? How can you work for 16 hours a day? Obviously, you'll burn out soon. I say, better take care, take care. But then she says, I have to do this, deadlines, deadlines. All of you have deadlines to meet, work to do, results to produce, which is what people say, na? अरे यार गवर्नमेंट में तो कुछ नहीं होता है because there are no deadlines. काम करो जितना हुआ हुआ नहीं हुआ तो नहीं हुआ. But you people have a deadline. See, I used to think doctors have a hectic lifestyle because we have no working hours really. See, I am. You might have seen from my degrees, I am a MS in general surgery also, and then I did my MS in orthopedics. So, apart from the first 2 or 3 years of my life when I was a general duty doctor, MBBS, in Kashmir, where I had a comfortable life. And since that, I was in a medical unit. After that, I was a doctor for a particular unit, what is called the regimental medical officer. So nothing. What you'll have, what 10 patients, all fit guys. And then in the evening, afternoon you sleep, evening you go play some games, evening go to the mess and have a drink, watch TV, have dinner. But after 3 years, ever since I became a surgeon, I'm on call every single day, rather at every single night. So you operate about 2 or 3 times a week. You see outpatients 2 or 3 times a week. Rest of the time you're doing ward work and writing case sheets and writing discharges. So I thought my life was hectic. But still, at least the Sundays also we used to go. It's not that Sunday was a holiday. We never had a 5 day week was a alien concept. We've always had 6 day weeks, and specialists have a 7 day week because we have to go. You can't say patients won't come on Sundays or patients don't want to see you on Sundays. Patients expect to see you every day. So I used to go even on Sundays, except that I used to go not in uniform in civis, and I used to go instead of 8 o'clock, I used to go at 10 o'clock and come back by 1 o'clock and probably not go in the evening. That is the only difference on a Sunday. But you people have hectic working hours and there are no fixed working hours. That is another problem. So the second problem is prolonged sitting at work. So now this particular cartoon is showing this girl sitting in a high sort of a chair. One leg is straight, the other leg is slightly folded, and she's peering into a laptop. So if you're going to sit like this for say 8 to 10 hours, obviously your legs are going to hurt, your knees are going to hurt, your back is going to hurt, your neck is going to hurt. So uh, you can't help but if you have to do it, you have to do it. So what can you do? You can change your sitting posture. You can change your writing table. I mean, you can change your chair. So today, thank God, you get lovely chairs. You know, the car seats you've seen over the years, the good old Ambassador in the Fiat has a standard seat. There was nothing shaped about it. It used to have a nice, like a sofa. It was comfortable, but there was nothing. But today, you see right from even the old Maruti 800 which started, and now the fancier cars, all have got nice ergonomic seats, we call them. So they have a little broader, then they're a little narrower in the middle of the back, then they go up and they have a headrest. And this lower back is pushed forward a little. Because if you see your own spine, your lower back is, convex forwards, which means there is a depression, which needs to be supported. You know, then your mid back has a convexity backwards. So, and your the cervical, the neck has again a convexity forwards. So that God has made this like that so that it's a nice springy action, which is why you're able to jump comfortably from 3, 4 feet without getting any shocks or pain. Even if you wear proper shoes, you can even probably jump from 6 feet or 10 feet. So because the spine is curved like that, front, the back, front, and then the back. So the curvature is given with a particular reason in mind. I mean, the maker or God, whatever you want to call him, has given you the particular thing. So we need to support the spine. Because if you see, man is the only bipedal. Bipedal means walking on two legs. All the other animals of the animal kingdom all walk on four legs, whether it's a dog or a cat or a horse or an elephant or a tiger. You know? That's why most of them don't have backache. I mean, at least we don't know. They haven't complained to me. But one would imagine that they won't have backache. The back is nicely supported on four legs. You can imagine if a table is on two legs, how will it be stable? It won't be. So it needs four legs. But we have to be stable on two legs. We have to be able to run, jog, walk, everything on two legs. It's only when we crawl that we are on four legs. But that's only with the first year of life. After that, we are on two legs all the time. So our back is constantly under stress. And which is why we need to take care of our back. The third problem is minimal physical activity. So if you're going to be sitting for 10 to 12 hours a day, at the end of the day, whether it's 8, 7 o'clock, 8 o'clock, 9 o'clock at night, your mind and body, everything is tired. You're fatigued. So you're in no mood to go for a walk or a run. At the most, you'll go have a bath, probably come back, pour a drink, have an early dinner, and try to hit the bed. So this people say there's no time for physical activity. So minimal physical activity is another big problem in today's generation. Of course, I'm glad that today when I go in the mornings, I see a lot of youngsters walking or jogging or running. So that's a very good thing. But then you have to take out time. See, everybody has got the same 24 hours. Nobody's got 25, nobody's got 23. All of us have the same 24 hours given by um, the Almighty. So how we use this 24 hours is what makes it. If you're working 12 hours, then in the other 12 hours, you have to take out at least 30, 40 minutes every day to do some form of physical activity. With all this physical inactivity, which is also stressful because the muscles go into a spasm when you're sitting for a long time, which is why I advise most of my patients. Although medicines and all are okay, I'm not too much in favor of too much medication. I myself hardly take a tablet ever. Even when I have a backache or headache, I prefer to just use a hot water bottle or lie down for half an hour. When I used to operate, I mean, I've had backache. I mean, ever since I entered medical school or medical college, that's at the age of 16 or 17. And that's 50 years back. I'm just going for my college golden jubilee next week. So 50 years I've had backache. So, and I've been a surgeon, I told you, a general surgeon and then an orthopedic surgeon, standing and operating for 1 hour, 2 hours, 3 hours, sometimes 4 hours. So at the end of it, I used to be absolutely finished back. So I used to just lie down flat in the OT with my knees bent. 10 minutes you lie down flat and then you're up and about. So what I mean is you've got to give yourself breaks. If you have to sit in front of a laptop for hours together, after every 1.5, 2 hours, I'd suggest just close your eyes, relax, and get up and walk for just for a couple of minutes. Go to the washroom, go have a glass of water, say hi to your friends or colleagues in the next cubicle, come back and sit up. And your mind is fresh, your body is fresh to take on the next couple of hours. So that's very important. With all this, you have a lot of mental stress. Well, like we were talking about, you have deadlines. You have a deadline to produce results. So that obviously is going to lay a lot of mental stress on your body. Today, we think, we all think the film actors and actresses have a great life and they've got tons of money. But now you've seen whether it's Deepika Padukone or Anushka Sharma or Virat Kohli, all these big stars are all now come out and said they're having mental issues. Depression is a very major mental problem, which now slowly is coming out of the closet. Because we in India, mental issues are taken very badly. You think, "Arey, wo to pagal hai." So, without realizing that it's absolutely normal to have mental issues if you're having such a hectic um, work schedule. So, mental stress adds to all this and can also lead when we talk about something called fibromyalgia, you'll realize that there's a lot of mental into it. That's why many diseases are now called psychosomatic disorders. Psycho means mind or the mental, somatic, soma is the body. So, right from peptic ulcers to backaches, they all have a mental element. We spoke about the wrong posture, about the right chair, the right table. So, wrong posture is an important element, especially if your life is going to be like this sitting in front of a chair, laptop or a chair all throughout the day. So, a person who's more active is actually less likely to get all these problems than a person who's active mentally but physically not really so active. So this posture, what she's showing, it's a straight back chair. See, dining chairs are made straight back because you don't expect to spend more than 15, 20 minutes eating your food. So that's fine because that time you want to sit erect, you want to make sure you're eating properly with a fork or knife or a hand, and then leave the table. But here, when you have to sit for a long time, you must make sure you have a proper chair. Yeah. Okay. And at the end of it, the last slide is very nice depictive. We are rats in a rat race. So who does more? Who produces more result? You must. I don't know if you've seen that Kajol, the new OTT thing, the trial, where she's an intern and the other chap is an intern, and only one of them can retain the job after 6 months. So each one is trying to outdo the other or pull down the other. So that's another problem, which again leads to mental stress, which will again lead to backaches and neck pain. So coming to some common orthopedic problems. Neck pain, upper back pain, low back pain. In my outpatient department, if I see 100 patients, I used to see 100 to 150 patients when I was in the military hospital here. So about 60% at least would be neck pain, back pain, and knee pain. Of course, because my patients included a lot of elderly, fathers and mothers of the serving soldiers. So a knee pain. So this upper neck pain is becoming more common in the ages 25 to 40. Like I said, basically because I think because of your wrong posture and sitting for long hours in front of a television screen or a I mean, a monitor or a laptop. Upper back pain is similar to that. Neck pain and upper back are really connected. The whole back muscles, right from the base of the skull to your lower back up to the buttocks, that area, is actually just series of muscles which are connected. So if the muscles are not relaxed or the muscles are not strong enough, you tend to get backache. So neck pain is becoming pretty common in the younger age, and upper back pain, lower back pain are also becoming more common. And 30 to 50 is really young. You're at the peak of your fitness when you're around 30. Until 50, you're absolutely, I'm sure you all know the definition of old age is gone. Was Satya Gaya. At 60, people said, end of story. Thank you, retired, just sit down, relax. So Satya Gaya means if he's talking rot and he's repeating the same things. But today, 60 is no longer old. I think now the definition of old, elderly is probably 70 or 75, and old is probably after 80. And low back pain is probably the most common type earlier, always affecting almost 80% of people. They say there's hardly a person in this world who's not had low back ache at some time of his life. In fact, low back pain or low back ache is one of the commonest problems in the US, and the amount of billions of dollars or man hours, as they call it, lost because of low back pain is amazing. My elder brother is in the US, he's a specialist in pain. So he goes to the court lots of times to give evidence whether this person's job could have caused him the low back pain, because those guys claim, no, the guy says, because I worked in your factory, because I picked up this very heavy equipment, I've got this low back pain. He sues them for $500,000 or $1 million. So they go to court, he goes to court, and then this thing goes on and on. So low back pain costs a lot of man hours of work and loss of billions of dollars in the US. I'm sure we don't have exact statistics for India, but I'm sure it'll be there even here today. The most common cause of these kinds of pains in young adults, like you people, with the target audience today, I believe is in the range of 25 to 40. So in your people, I think poor posture is a major thing which is easily correctable, which you just have to realize that this is a problem. You can easily correct it without any issues. Common injuries. Again, young active people like you are going to have some injuries because you want to run, you want to jog. So the ankle, knee are obviously the most commonly, and to a certain extent the hips are the most common in the lower limbs, and the shoulder in the upper limb, because the shoulder is a lovely joint, it's got a huge range of motion, but because it has a huge range of motion, it is also the most unstable. So if you are lifting weights in the gym without proper counseling, without a proper trainer, you're likely to cause sprains or strains. And so individuals under 40 are more likely to suffer from sprains and strains. Sprains and strains are similar. A strain means both these are ligament, soft tissue injuries. You must understand the difference between sprains and fractures. So fracture is a break in a bone. Simple as that. All of you know that. I think so. You know? So a strain is just a strain, as the English word suggests, on a ligament soft tissue. A sprain is a tear of a few fibers of a ligament. Ligaments are things which connect a bone to a bone across a joint. So many ligaments are very important. ACL and all. You might have heard something. I've got an ACL injury in the knee. I've got a Hardik Pandya has just got a lateral ligament injury of the knee, of the ankle, which is why I was surprised. He said, he'll play the next game. So, but obviously now they realize he's got a lateral ligament injury. So he's actually going to be out for maybe 3 weeks. He may not play the entire World Cup. So ligament injuries are serious and should be taken seriously. So fractures are more common in people under 30 because of the active lifestyle. You are running, you trip over a thing, you can have a fracture, of the ankle, the ankle bones or the foot bones, what's called the metatarsals and the ankle bones. Or, of course, we are involved in a motorcycle accident. I mean, we see a lot of them. You break your thigh bone. The thigh bone is the largest bone of the body, the strongest bone of the body. But obviously, if you're going to be traveling at 60 kilometers an hour and you're hit by uh, a four-wheeler who's traveling at 80 kilometers an hour and it hits your thigh bone is going to break. So fractures are very common in high-speed injuries. Today, the bigger bikes, the Harley Davidsons and the Bugattis and all, they can go at 100 kilometers an hour. And the cars you've seen, Rohit Sharma was caught doing 220 kilometers an hour on the Mumbai-Pune highway. So these new cars can go really fast. In God forbid you have an accident. Rishabh Pant is just lucky to be alive. Other common musculoskeletal injuries are, brachial neuralgia. See, brachii means arm, neuralgia means pain along the nerves. So you have, typically, sometimes people say the pain is here, sometimes they say it's coming down the arms. So that is what is neuralgia. Why does this neuralgia occur rather than pains? Because all pain is rooted through nerves, of course. Okay. But when we say neuralgia, that means directly affecting the nerve roots, which means normally it's a disc problem. You might have heard of a slip disc, what we call a prolapse disc technically. So a slip disc is the disc is a soft tissue between the two bones of the spine, the vertebra. So there are discs everywhere. There are 33 vertebrae, so there is a disc between each vertebra, except the last eight. So those discs sometimes come out, and then they impinge on the nerve roots, and that causes severe pain radiating like a tingling numbness and all. So this pain, weakness, numbness you can have, that's called brachial neuralgia. The other is tennis elbow. You might have heard the most famous guy having a tennis elbow was Sachin Tendulkar. So he who never played tennis. So that is the great thing about tennis elbow. I haven't heard of a single tennis player, whether it's my Rafa or Djokovic or Roger, having tennis elbow. Probably they know how to play tennis. So people who don't know how to play tennis and play tennis, I think, get tennis elbow. That's pain here in the outer aspect of the elbow. Again, the muscle is pulling where it's attached to the bone. It gets pulled because of sudden pressure on that. If you have not taken the tennis ball properly, so you can get that. So tennis elbow. The similar thing on the inner side is called a golfer's elbow, because when you play golf, your swing, this muscle is straight. So uh, fibromyalgia. This you might have heard of this word. It's a not very well understood disease. We can talk more about it if there are any problems. So this is when you have vague aches and pains all over, typically in the neck or the arms or the shoulders or the back, and this is usually chronic, going on to 2 3 months, and usually associated with fatigue. You feel tired at the end of the day. I don't know what to do. I don't have energy. And the last is these overuse syndromes. You can do if you do too much, too fast, too little. Go to the gym, and many people I say, "Oh, I used to go to the gym." They're 30 years old. When did you used to go to the gym? When have you stopped going to the gym? No, after that there's no time. So you go to the gym for a little bit, quickly lift some. Let me do some biceps and one triceps and one bench press and my pecs and my thing and come off. So if you've done it improperly, if you've had too much weight you have lifted not properly, so you can develop either a tear of a muscle or a sprain of a ligament. So these are, or by doing the same movement repeatedly. So there's a limit. That's why we normally say sets of 8 or 10 or 12, not sets of 30, 40. There are other problems like which are inflammatory or autoimmune, which are also unfortunately becoming more and more common. Rheumatoid arthritis is one such disease, which when I was reading medicine in 73s and 74s, so there we used to say rheumatoid arthritis is a chronic inflammatory disorder. Polyarthritis involving multiple joints symmetrical over the age of 40 or 45. But today I see younger people also getting rheumatoid arthritis and so many other autoimmune. This is another famous thing you might have heard. Are ye to autoimmune? Autoimmune. What is autoimmune? The immunity is supposed to be help the body, but when the body is fighting against itself, that is called an autoimmune disease. Unfortunately, for some reason or the other, a lot of autoimmune diseases are becoming more prevalent. Rheumatoid arthritis is one of the common ones, which affects multiple joints. So it can affect younger people. Of course, we always knew there was a type of rheumatoid which affects very young people called juvenile rheumatoid, which is in teenagers, which affects a 12-year-old thing. And unfortunately, it's a very chronic disease, and patient has to suffer for a long time. Ankylosing spondylitis is luckily not very common, but it's again a very debilitating disease because it causes inflammation and stiffness of the spine. So nowadays, when I see a young man, a young male, because it's more common in males, with stiffness and backache, and since I can't examine him, this problem with these teleconsults is you can't touch the patient. And I am 40 years of my life, I've been used to treating patients by talking to them, by touching them, examining them. But when you can't do that, so I suspect this, so I try to do some investigations to rule them out. Today, other problems that are also in today's younger generations, one of them is obesity. Obesity, when I went to the US only once very long back, I see a lot of these blacks used to be fat. And I'm not that well, the whites went, but more things were there. But then I realized later people told me, yeah, if you're doing well and already you're not fat because you know what to eat. While these people eat, when you go to say these nachos and cheese, you take the nachos and you can take as much cheese as you want, free. So you take nachos, you take cheese, then you go and take some more cheese, then you go and take some more cheese. The Coke thing, or Patiala glass they give you, and you can take free refills. So free में मिल रहा है, so you eat more, so you become obese. So BMI you all know, um, is above 30 is considered obese. So again, lack of physical activity is what causes increased BMI and obesity. Stress we've already spoken about a little bit. We can either have headaches, fatigue, sleeplessness, insomnia. And lastly, a beautiful phrase of work-life balance. What is work-life balance? Work, life. So work well, बोलते हैं ना, sleep well, work hard and party hard. Party hard and sleep hard and work hard. So that is work-life balance, and each one has to find his own work-life balance.
Actually, I have been diagnosed with autoimmune. It's been a year. I have been suffering from that. Initially, my autoimmune was at the higher level. I have been
Hey, sorry, one
di-
second, Pragya. What do you mean by autoimmune? See, there are a lot of diseases which are called autoimmune. What is the diagnosis?
it was rheumatoid arthritis. Although it is not that severe. Initially, I
Okay.
used to have joint pain and all that thing, but now it is fine. But still, my whole body and my skin is tight. Like it's very rigid. So I'm still on medication since a year, and my
Nahi.
body just get rigid, stiff. I just feel the pain in the nerve, sometimes also in joints, but it's not that continue. I have a pain in joints.
See, rheumatoid arthritis typically is a symmetric polyarthritis involving the small joints of the fingers and feet, and now it then also involving the larger joints like the wrist and the elbow, and later only involving the knee and the shoulder. But they are all typically an arthritis. That means joint. Arthros means joint. Itis means inflammation. So rheumatoid arthritis has to involve the joints. Otherwise, it is not rheumatoid arthritis. You're
Okay,
saying
but
it is not joint pains. You're saying it's aches and pains.
hmm, right. It's like the whole body. Initially, it was whole swelled up, starting from the feet till head. Now
Nay,
it's
When
been.
when were you diagnosed with this, and what treatment are you on now?
I was diagnosed it in last November, and I have my treatment starting from PGI Chandigarh. So they have prescribed me, I guess, HCQ 200 I am on, and now
Okay,
more tests are being conducted. So I
uh,
guess they'll suggest me some other
okay.
drugs as well.
HCQ. Are you also taking methotrexate,
No, Nicardia they were,
Politrax?
yeah, only HCQ and Nicardia I was having.
Okay, okay. I am not very convinced that you've got rheumatoid because if you don't have joint pains, see, there are a lot of other things I told you. There are something called seronegative spondyloarthritis. We have backache also,
No, no back.
but backache, knee pains all over means where exactly? I'm not able to really. Uh,
It's. I feel like suppose there is an elbow. I just feel in front of elbow around the knee. I don't feel. I do feel sometimes if I am in a constant standing position, my legs will be stiff. I won't be able to, bend my knees. They will be all stiff and they'll ache.
Acha, this stiffness is more in the mornings. Does it become better after 1 or 2 hours?
It's not necessary that it is a continuous pattern that I'll be facing it in the morning. But I guess if I'm continuously standing or am I in a continuous posture for some long time, then I'll feel that stiffness that I cannot move. I cannot fold my joints. Even at night,
And
I cannot move.
you
Hmm.
will need to be more active. In the early morning, you get up, you move all your, see, that's why in the army, we have this PT, physical training. We all go
Yeah.
for PT in the morning, wear our white shorts and white t-shirt and white socks, white thing, and go and we move all our joints, you know. So
Hmm.
when you get up in the morning, please move all your joints, whether it's right from the fingers to the wrist, to the elbows, to the shoulder, do a little bit for the back, do bend forward, touch your toes, bend your knees, bend your hips, try to squat. So if you move all your joints, your stiffness will go away faster. Continue medications. If you have got from PGI Chandigarh is a well established, well respected institution. I'm sure the doctors there must have done all the concerned tests and put you on the medication. Continue your medication. See, nowadays what we call it is called mixed connective tissue disorder. MCTD is another diagnosis which is there. So which connect, it's like an umbrella. So MCTD will
Hmm.
include a lot of these things which are not typically. See, rheumatoid arthritis, we have a blood test called rheumatoid factor. So that is
Right.
positive in about 70-75% of cases of rheumatoid
Hmm.
arthritis. So the other 25, you might miss it. So we have other tests like anti-CCP. We have something called ANA, anti-nuclear antibody. So these tests will give us a thing. But sometimes when it doesn't fall into any of these, so we call it a MTCD. That means a mixed connective MCTD, mixed connective tissue disorder. So you
Right.
probably will fall under scleroderma or MCTD. But the
Yeah.
HCQs and these are. Have you been given any of these infliximab, adalimumab, rituximab, any of those things?
No, none of these have been given. But recently I visited, so maybe they have prescribed me CT scan and echo test. My tests are done. I just have to collect the reports that is pending. So
Yeah.
maybe they'll just prescribe some more drugs after that.
See, I think today we have got some very good drugs called monoclonal antibodies, MABs, MABS. Okay. I'm
Okay.
sure you go back to PGI, they'll do that and they probably will put you on one of these monoclonals. They are excellent. I mean, they are almost, because we don't talk of cure, we talk of managing all this, but these are almost curative. So these monoclonal antibodies are excellent drugs. I suggest you can even talk to your doctor about monoclonal antibodies. So you can write it down if you want. MABS, MABs. That's why we have
Okay.
golimumab, adalimumab, ritumumab, so many mubab. In fact, I forget the names also. All of them are tongue twisters also. So
Yeah.
please talk to your doctor about the medication and how about using these monoclonal antibodies.
The first question is, are there any lifestyle habits that can accelerate bone loss and how can they be mitigated?
Lifestyle habits. The first lifestyle habit I said was a poor physical activity or minimal physical activity. So physical activity is needed to keep the bone strong. Bone is not like a piece of wood just because it is hard. Bone is a living tissue which turns over every day. Calcium has to go out of the bones, calcium has to come into the bones. Calcium has to come into the bones, calcium has to go out of the bones. Because calcium is required for so many other things. 99% of the calcium, almost a 1 kilo calcium is there in the body, of which 99% is in the bones. But it is not just lying there like a dabba. It is not like a bank. It is like bank, How do you do it? You take out money from bank, you put money in bank. You take out money from bank, put money in bank. And then your money grows. You know? You put it in FD. Then you do some mutual funds. So it's like that. So you need activity. So what activity? At your age, I'm 25, 30, you should do either a brisk walk or a jog or a run and do some physical exercises. I told you simplest physical activity, karpa karpa. Nowadays, yoga has become very popular, very good. So do Surya Namaskar is one of the best things ever. So if you are into the yoga type of thing, do yoga, Surya Namaskar. If nothing else, just move all joints of your body in the morning. That is the warm up. Then go for nothing else. You don't want to run, you can't run. Go for a brisk walk. You need to walk, and most of you, I'm sure, have got these types of watches. You must, that your thing, you should be doing 8 to 10,000 steps a day. With about 1,500 steps is roughly a kilometer. So if you do 10,000, you'll be doing about 6 kilometers. So that should be your aim. Activity, correct posture is what can mitigate these problems of osteoporosis, which you may develop after the age of 45, 50, more so if you're a female. You all know that females are a little more prone to osteoporosis after menopause because of the loss of estrogen. Males also can get osteoporosis, but they'll get it at a later age by about 55 or 60 or 60. So that's,
Right. This
and of course, a
really
proper diet, rich in calcium, vitamin D. See, vitamin D, the problem with vitamin D is where there are no plant sources for vitamin D. There are only animal sources, and especially only fish. And the simplest source we don't use, sunlight. Sunlight is the best source, free source of vitamin D, but you need to sit for 20 to 30 minutes in sunlight with your skin exposed. You cannot wear a burqa and sit in the sun. There's no point. And you have to sit, you cannot sit behind a glass. You cannot put a sunscreen and sit. If you put a sunscreen or you're sitting behind a glass, the vitamin D will not be made. See, what happens is sunlight acts on a particular thing called 7-dehydrocholesterol, which is just under your skin, and converts it to vitamin D. For that, the skin has to be exposed to direct sunlight, preferably between 10 o'clock in the morning till 2 o'clock in the afternoon. Unfortunately, most of us don't do it or can't do it. We are all in our air-conditioned offices at that time. We don't want to go out. And even when there's a sun, we just quickly wear a cap and take an umbrella and cross the street and go to the restaurant. So we just don't get sunlight. So if you can get sunlight, now, why all these fancy women who used to do sunbathing, what do? They're getting sunlight. They're doing it because they're too fair. They want to get tanned. But along with that, they're getting vitamin D. So that is vitamin D, calcium. Calcium, we all know about calcium, and we all know Mako Doodh Pio, Amul milk. I wrote that. Milk is still one of the best sources of calcium. Milk is there, curd is there, yogurt. You can have cheese is there, nuts are there, almonds. Okay? Even simple green leafy vegetables like methi is excellent. Now kale is supposed to be very good. I've never had kale. I don't know if fancy आप लोग youngsters, you know all about kale, I think. You know, क्या वो Malaysian में वो होता है ना कुछ उसमें kale and something else, some other something. क्या बोलते बड़े बच्चे, I don't know. But kale is supposed to be very good. Spinach also is not bad, but methi is better than that. And fruits like figs and apricots, they all have calcium. So a diet rich in calcium, rich in vitamin D, or some vitamin D, and of course a good high protein diet with minimum carbs and less fat. I mean, that is a known affair. As far as bone health is concerned, the calcium, vitamin D are the two things, and this way you can get it.
How can one solve a slouching problem?
Slouching. Now I'm slouching. How can you solve? Don't slouch. Hai na? Why do you slouch? Because you're peering into your laptop. Why do you want to peer into your laptop? If you have to peer, that means please check your eyesight. Or sit back. See, now I'm sitting. I told you I have backache for the last so many years. See what I'm using? I'm using this is actually a car seat cushion, but I'm using it for my back, so that my back is well supported. That's why I can talk to you for hours sitting together, and my back is well supported. So slouching is a habit, a bad habit, like so many other bad habits. So what do you do to bad habits? You have to leave the bad habits. So slouching is not something which. How can you prevent slouching? Don't slouch. As that simple as that. So that is why. What do they say in the military? Chest out, stomach in. So that's why I keep my stomach in all the time. So my wife tells me, how can you keep your stomach in all the time? I say, boss, I've got used to it. Even when I'm talking to somebody, especially when I'm talking to a person of the opposite sex, of course, I keep my stomach in so that nobody sees my little bone. So that's the thing. Slouching is just a bad habit. You just don't slouch. Make sure your shoulders are nice and uh, straight ahead, and that's it.
What are the risk factors for osteoporosis, and can they be prevented?
Risk factors. Again, coming back to the same thing, lack of physical activity. You know, the couch potato. That is why the name came couch potato. If you keep sitting on the couch, and eat potato chips, you will become a potato. Yeah? So that is the first risk factor. Second risk factor is menopause for women. But if I'm talking to 25 to 40, none of you are in that age, so you don't have to worry about the postmenopausal. So how to prevent the postmenopausal? Be active during the postmenopausal. Okay. So good physical activity, which means what? 30 to 40 minutes of activity daily, 5 to 6 times a week. Sunday, chutti maar lo. Okay. But minimum 5 days a week. I'm sure everything, Femina mein bhi aata hai, aajkal isme bhi aata hai. So 5 or 6 days a week, I would say, do 8 to 10,000 steps a day of walking, running, or jogging. You like swimming? Do swimming. You like to play games, badminton, tennis, squash, anything, fantastic. So be physically active. That is the first and most important preventive measure. The second is diet. See, diet and exercise are the treatment for diabetes, treatment for hypertension, treatment for osteoporosis, treatment for good life. Good work-life balance के treatment वही है. Diet, exercise. If you diet and exercise, when you exercise, you get your good hormones going. You get your endorphins. You can look up Google and what are endorphins. Endorphins are feel good hormones. Your dopamine will come. Your endorphins will come, and you'll feel good. Once you feel good, you are good. Okay, so diet and exercise is the first thing. And diet already we just spoke about calcium and vitamin D. The foods rich in calcium, I've just told you. The foods rich in vitamin D. The foods rich in vitamin D are only fish. Typically, all the salmons and sardines. If you're a fish eater, so as it is nowadays, people realize that fish is probably the best kind of meat because firstly, white meat is now preferable to red meat. That is why chicken and fish is better than mutton. And secondly, fish is even better because it's got this vitamin D. Okay. Vitamin D and A, as many of you must be knowing, are fat soluble vitamins. So, okay. So that is why nowadays about 90% of Indians are supposed to be deficient in vitamin D. So I get a lot of vitamin D tests done, and really that's true. I don't know why. It could be the whole thing could be a thing by Western world to promote their vitamin D, but for whatever reason we are. So since we are not getting sunlight and we don't eat fish, obviously you're not going to get it. So the best is to pop in a vitamin D tablet. Get your vitamin D test done. If it is below 20, then please eat vitamin D 60,000 units. But don't do on your own. I would suggest see a doctor before that. Because one more thing about vitamin D, too much is not too good. See, vitamin B and C, you keep taking too much, no problem. It will go away in your urine if your body doesn't need it. Vitamin D cannot go away in your urine or stools. It will stay there in your body and create hypervitaminosis D. So there is a disease called hypervitaminosis D. So too much is not too good, so which is why you must take. If it is deficient, please take it. 60,000 units, 6 to 8 weeks, under the supervision of a doctor.
So, what exercises or physical activities are best for bone health?
There's nothing specific. If you're a gym man, go to the gym. See, apart from your bench press and apart from your lats and apart from your quads, do your spinal exercises, which is hardly ever taught or such thing. I've not seen anybody in the gym doing exercises for the back. So I don't know if the trainers know about spinal exercises also. Basically, there are a few. Yoga has got a lot of these exercises. You know, the there's so many asanas I don't remember the name offhand. The bow pose, na? You basically lie on your tummy and extend your back. Those are very good exercises for extension spinal exercises. If you go to any physiotherapist and ask him to show you some extension spinal exercises, he will show you how to do these extension spinal. Many of the, in fact, my treatment is medicines only for about 5 to 7 days. After that, it's physiotherapy for 7 to 10 days in the department. And then in those 7 days, you learn about physiotherapy and start doing it at home. You don't need to go to the physiotherapy center for months on end, whether it's after a total joint replacement or for a backache. But you need to go there for about 7 to 10 days because there are some in equipment which are doing a shortwave diathermy is there, interferential therapy, which are machines which are available there. Plus, the person is qualified to tell you how to do the exercises and which is the best way to do it and which is the best way not to do it. So learn those exercises and do it. Otherwise, I told you, simple exercises are walking, jogging, running. Swimming is a fantastic exercise.
Actually, I am doing my work. My neck and hips are heavy pain. After 1 or 2 hours, within 1 or 2 hours, I got. I'm not relieved. So, what is the issue?
See, neck pain, what happens is because if you bend your neck too much, that is why,
Yeah.
in fact, Ajkal, na, there is a particular thing. If you hold your phone, you have to look down onto your phone. If you keep constantly looking down on your phone, this position is not good for your neck. So that is why I tell people if you're sitting on a laptop, make sure the table is at a good height. That means that you are facing almost there or only slightly like this. One is you know now when the news are talking, there is something called a teleprompter, which is in front of the screen, which is where they're able to go on saying. But that is there at that level. but your laptop is going to be little lower. So,
Yeah,
but
yeah.
it should not be so
It's
much.
located in 45-degree angle, so that's why I'm facing this issue.
Yeah, 45-degree angle is
Yeah,
not good. You should only be at a 20-25-degree angle so that you are
20,
facing
yeah,
like this.
okay.
You can see
Hmm.
me from here. It should be this angle, not
Okay.
this angle. And it has been proved that if you press your neck down too much, the weight on the disc, you remember I spoke about disc coming and pressing on the nerve, that brachial neuralgia. If you press your neck further 45 degrees, you are compressing that disc. So over a period of weeks or months or years, that disc will be compressed, and like you squeeze a lemon, now what will happen? The juice has to come out. So when you
Okay.
squeeze the disc will come out. When it comes out, where can it go? It comes outside. When it comes outside, the nerves are going. The nerves are going here, here, C3, C4, C5, C6, C7, C8, like that throughout the body. The nerves are going from the spinal cord.
Oh,
So wherever the disc comes, it presses on that nerve root. Wherever that nerve root is there, you're going to have terrific pain. So this is your problem. So gain correct posture, avoid too much of forward bending of the neck, avoid too much jerky movements of the neck. If you
okay.
do too many jerky movements, first of all, you'll get giddy. If you're having one-sided headache, please consult a doctor because it could well be migraine. See,
Oh,
migraine is a typical one-sided headache where sometimes you have nausea, sometimes you see things in front of you or eyes, sometimes blinding lights or colorful lights, or sometimes nausea or vomiting. So if a headache unilateral with any of these signs is usually migraine, which is not anything to do with orthopedics or the spine. It has
okay.
something to do with the blood supply inside the brain. There is vasodilatation of those blood vessels. The vasodilatation means that they are becoming bigger. So that is why you have the splitting headache on one side. So if it
Okay.
is if a headache is troubling you, first get your eye checkup done and consult a physician to check out if it is migraine.
Yes, sir. I just want to ask why this autoimmune is triggered, or can it be reversed?
I wish I knew. See, the problem, see, allopathy, at least we say that we don't know many things. You know?
Right.
That is why the commonest cause of most things is idiopathic. Idiopathic means cause unknown. Why the body goes against yourself? Some people are more prone to it, unfortunately. We call them atopic individuals. So, some people, they go, in Pune, there's something called a Congress grass, chota chota white flowers. So if you go to Bangalore or Pune, people get wheezing, they get sneezing, they get wheezing, and they get cough the minute. And like my brother used to go to Chennai, he was very happy. Lousy weather, sweating, humid weather, but very healthy. He goes to Bangalore, nice cool weather, but starts sneezing because the something in the air, something is triggering off that thing. So once it triggers off, so autoimmune is also something like something is triggered off your own body to fight against your own body. Why it does it is really not known. Each individual case has to be investigated, and there are so many allergens. Allergic rhinitis is a well-known thing. People are allergic to dust. People are allergic to some the dog hair or the cat hair or the weather, the cold weather. Some people are allergic to cold weather. People
Right.
say AC में जाते ही मेरे को हो जाता है. I went by second AC, मेरे को cold हो गया. So you're allergic to cold. So what you're allergic to, what your body does, is a little difficult to say. It's not such a simple thing to answer, frankly. But yeah.
So growing up, I was told that when you do so we like to do like this, right? So when you do that, you end up losing your joints, something like that. I'd heard. So wanted to know if it's a myth or like it.
Yeah, it is. It is a myth. It is a myth. I mean, there is no need to do it, but I know even I do it once in a while. You get bored, and when you go to the barber, वो बढ़िया सा मालिश कर देता है. ये सब करके then he pulls here, he pulls there, he does the. You feel nice. So it is just a matter of sort of relaxing your tissues. So that sound, yes, but when you get it done with the I mean, not you. हम लोग जाते हैं बार्बर करता है आप लोगों के लेडीज का पता नहीं मेरे को वो बार करता है and there he does sometimes like this that you got to be very careful guys don't let that guy touch your neck if he does this sometime na it could bloody you remember wo, I'm sure you've seen those fancy things where Sallu tiger zinda hai, tadak, and the guy really just dies. So please don't do all those. Let him not touch your neck to move your neck. This thing is harmless. And when you sit down and get up, thoda bahut kadak kadak hota hai, so there's nothing to worry. I told you there's the fluid moving in between the joint because it cannot come outside the skin. So एक जगह से दूसरी जगह जाता है, so it is just called. But there's nothing. You won't lose your joints. Don't worry.
So I've heard, like I've been told, and I've heard that. I mean, at least my grandparents they used to say this that बैठ के पानी पियो, खड़े होके मत पियो, it makes your knees weak. Is that again? Is there a reason, specific reason behind this, or is it?
Only today, my wife was telling me this. Mira, see, my mother-in-law is with me. So from
Okay.
2:30 to 3 o'clock or something, she sees one Chauhan Saab, some Ayurveda. So I keep making fun of her. Chauhan Saab ne kya bola aaj? See, point is, these things I don't know what is the physiological basis. बैठ के पियो. See, लेट के मत पियो. I can understand.
That is there. Of
है ना,
course.
लेट के पियोगे तो it will go to the wrong way. Instead of the food pipe, it will
Correct.
go to the windpipe.
Correct.
But बैठ के पियो और खड़े होके पियो, गर्म पानी पियो, ठंडा पानी पियो. I mean, when I have a drink, I have drink with 4 or 5 ice cubes. People said, "इतना ठंडा पानी नहीं पीना चाहिए." I go to my elder brother's house who doesn't drink. उसके फ्रिज में पानी नहीं होता है. Because he
Because
says he don't drink cold
yeah,
water. And I've seen a lot of people don't drink cold water at all.
correct.
So that
correct.
again, I can understand physiologically. If you're suddenly putting cold water in your stomach, it may say कि यार क्यों मैं तो आराम से I was cozy. Why are you putting cold water? But हम आधी चीज किसके लिए करते हैं? 2 इंच की जुबान के लिए. So
Also,
you like
that
to have an ice cream? Have an ice cream. If
correct.
you don't want to drink cold water, don't drink. If your body
Someone
can
was-
tolerate cold water, go ahead.
Okay, thank you so much, doctor, for your time and for
My
such
pleasure.
a
My pleasure. Thank you so much.